Number 3, what is the term for a junctional rhythm with a rate between 60 and 100? Accelerated junction. Good. Number 4, in junctional rhythms, the P wave is often absent or inverted. It's rare that it comes after the QRS, but sometimes it does. Number 5, which of the following rhythms is characterized by wide bizarre QRS complexes and no discernible P waves occurring at a rate of 20 to 40? Idioventricular. Good. What is the most appropriate initial treatment for pulseless ventricular tachycardia? Defibrillation. What differentiates ventricular tachycardia from supraventricular tachycardia with aberrancy? Actually, fusion or capture beats. So we'll have to look at that more closely. It's SVT can have, if it has an alternate pathway, it can appear wide. It's hard to discern on your EKG. You have to have a 12 lead, and it is hard to figure out whether, and you're gonna have 5 cardiologists all have a different opinion as to whether it's VTAC or SVT with aberrancy. So, if it's SVT with aberrancy, it has fusion or capture beats. So I'll try to find an example to show you. Basically, for our purposes, if it's wide, it's VTAC.
So we get it right then, right?
I'll think about it. All right.
Make it extra quick.
Yeah. A patient with an idioventricular rhythm, which is the following is the most appropriate treatment if they are symptomatic? Atropine and pacing. Okay. And like I said, we don't wait to get our IV, get our atropine before we put on the pacer pads. We put on the pacer pads and turn on and start pacing them. Because for the most part, atropine's not going to work. So, because while you're getting all that done, your patient's going to die. So, that's why we put the pacer pads on first. All right, which rhythm is the most commonly associated with sudden cardiac arrest and requires immediate defibrillation? Defib. And number 10, what's the primary danger of prolonged idioventricular rhythms? What progresses to asystole? And then they are dead. Okay. They are safe. All right. Let us, before we get to that stuff, let us talk about the syncope. How many times did we get called for syncope? Fair amount, right? Sometimes the dispatches will be person passed out, now awake. As to whether they actually passed out, who knows, right? Unless there's a witness. Do they remember it? What were they doing at the time? Were they on the toilet bowl? Okay, so all these things we got to figure out. And also, if they did hit the ground, did they hurt themselves when they passed out? Okay, so should people that had a syncopal episode in general sign off and not go to the hospital? No, because the definition of syncope is an interruption of blood flow to your brain. That's bad, right? So sometimes an underlying cause can be deadly. And if they don't go to the hospital, you might be going back for a code later on. Okay?
Had the 18-year-old girl sympathized at the nail salon, and then we got her onto the monitor, and she eventually went into ventricular arrest for 17 seconds.
Wow.
Regular P waves, but no ventricular activity.
Well, that's not cool.
No, she was about to RMA until that happened.
Well, thank goodness the monitor was on.
Yeah. And then she was discharged 2 hours later because Garnett said, oh, the lead must have fell off.
Okay. That's a lawsuit waiting to happen.
Yeah, parents were not happy when they went to Columbia and those doctors were able to see the entire soul.
And does she now have a pacemaker?
Yep.
Mhm.
She was very upset that she couldn't go to Miami.
Okay, well.
Life is a little bit better.
Yeah, wow. Did you find out what the underlying cause was?
No.
Interesting. So, what would do that to a young person? Okay, it could be an undetected abnormality, long QT. Yeah, what else?
Drugs.
Drugs.
In general.
Yeah, general. What else? It's endemic in this area. Ticks, right? Lyme disease can cause third-degree heart blocks. So, if you ever have a young person with like, all of a sudden they're like passed out and they wake up and they're in a third-degree block or have ventricular standstill, yeah, it could be from Lyme disease that didn't get treated because they didn't know they had it. So, it's wild to see it. I have seen it twice, and they end up with a pacemaker. So, and a lot of doxycycline, but once the damage is done, it's done. So. Right.
For like ticks, can there also be like, oh, if you treat the Lyme, sometimes like there will be improvements and like cardiac, like being affected?
It depends on how far along the damage is.
Oh.
And it also, like, it can cause arthritis, it can cause all kinds, and other neural things, so it depends on when it gets treated as to, you know, if it's gonna cause long-term problems or not. And of course, there's like 3 other tick-borne things that we can get from ticks in the East Coast. And of course, now we've got like some Rocky Mountain spotted fever that came east as well, so hey, you know, good stuff. And people a lot of times don't know they've been bit. But if you spend any time outside, or if you have animals that spend time outside, and you all of a sudden have these weirdo symptoms, and you've got like fever and joint aches and all this other stuff, it could be tick-borne. So the doctors are usually pretty good here about testing for it because it's so, you know, so many people have it. And it doesn't come back like right away, but people can get pretty sick from it. So. All right, so let's list out some causes that can cause somebody to syncopize. What? Hypoxia. Yep, what else?
Hypotension.
Hypotension.
Hypovolemia.
Hypovolemia. Yep. MI. What'd you say? Vagal stimulation. Yes, absolutely. Anemia. Yep. Yep. What about hypoglycemia? Right, that's definitely one. They could also have a dysrhythmia. Right? That's like, I mean, obviously we're gonna check their sugar and we can fix that. We can fix, you know, the hypovolemia. So there's some stuff that we can fix, but we put them on our monitor, do a 12 lead, unless we catch something or the hospital catches it, we're not gonna necessarily know if they have a dysrhythmia. A lot of times people will get discharged and they don't know when it happened. But that's why it's important to get as much information from the patient as possible, because what were they doing? Were they straining to poop? Well, most likely, then that is increased vagal tone, right, which caused their heart rate to slow down enough to cause them to pass out, okay? It's usually self-limiting in that the heart rate picks back up and they become awake and they're generally fine. The older they are, with the more cardiac disease they have, and their vessels are stiff, it takes longer to recover from that. And sometimes they don't. Sometimes they die. Okay? So you can die from straining from pooping. You can die from straining from peeing. Okay? You can die from eating too much, because that will cause a vagal response as well. Right? So what does the vagus nerve do to our heart? It slows it down, right? It's like a brake caliper on the heart, right? Without it, our heart would just like beat at whatever rate it's going to beat, like and go pretty fast. But the vagus nerve is like a brake caliper, slows it down. How does atropine fit into that?
Like taking the foot off the brake.
Yeah, or it blocks the brake, right? So it blocks that response. So if it is from a vagal cause or increased vagal tone, atropine will fix it. Okay, so fluid also helps. So you have somebody, they're like passed out, they look like crap, they're on the ground, they're hypotensive. Get an IV of them, give them some fluid, try some atropine, and a lot of times that'll work if it is from increased vagal tone. Okay. It doesn't work if that's not the cause of their bradycardia. Right? What else? Electrolyte abnormalities. That can cause them to pass out as well, right? They can be low on potassium, their sodium can be messed up, chloride, all of that stuff can cause people to pass out. Who are the most likely candidates for electrolyte imbalances? Dialysis patients, yes. Because there's such a massive shift back and forth. When they have dialysis 3 times a week, they're most at risk for that. Okay? What else? There's something called sick sinus syndrome, where basically the sinus node is not functioning right, and it just like peaks when it wants to. And if the rest of the heart doesn't pick up the slack, that can cause them to pass out. They can have heart block. They can have had a stroke, right? Or bleed in their head that can cause them to pass out. So lots of different reasons. Some of them deadly, some of them not. But we can't rule out a lot of that stuff pre-hospitally. We can rule out some of it in that we can check their sugar and their vitals and give them fluid and all that other stuff. Give them atropine, but a lot of stuff we can't rule out. So, you know, especially an older person or even a younger person, you know, try to get as much information as possible, make sure they didn't hurt themselves when they fell. You know, are they perfectly normal now? Are they able to answer all your questions? And, you know, sometimes you have to ask them questions differently to really figure out if they're really with it or not. Because they might be able to tell you what day of the week it is, but can they tell you the month and the year? You know, they may know it's Friday because they play bingo, but like, do they know it's the year 2025? Do they know it's June? You know, so, and do they normally know that? Because obviously if they're in a facility, you know, their sense of orientation is a little bit different. But if they're living out there by themselves, they should have a kind of a good idea. Who's the president? Can they do a simple math problem, right? Because you want to make sure if they want an RMA, you want to make sure they understand what they're doing and the consequences of not going to the hospital. And if you're ever unsure about that and their competency, put them on the phone with the doctor, okay? Because RMAs are the ones that go to court the most, that you're going to find yourself getting screwed on, okay? So you have to document very well. And if, honestly, I've been on scene for an hour with people. If I think they really need to go to the hospital, I will sit there with them and do everything that I possibly can and put them on the phone with the doctor if I really think they need to go, because if they don't, they're going to die. And I'll tell them that, because, you know, it's like, look, I don't want to come back here and find you dead, because it can happen. And sometimes they're just really stubborn and will not listen and talk to the doctor, and the doctor will say, okay, sign them off. And it better be your best documentation of your life, because when they do hurt themselves, die, whatever, you know, the next day, later on that day, guess what? They're going to be pulling that PCR, because somebody's going to say, well, the ambulance was here, why didn't they take them? Right? Same thing with your patients that, you know, how many times do we call for a lift assist? Right? The majority of the time, people are on the floor for a reason. Sometimes, okay, they trip over the dog, or the cat, or whatever, but Most of the time, it's because they're weaker than normal, or something else is going on, okay? And they probably do need to go to the hospital. So you better document. I don't want to see you guys documenting no patient found, because you have nothing to cover yourself, okay? You have no vital signs, you have no assessment, you got nothing. So when that patient dies, or, you know, ends up going to the hospital later on, they're gonna say to you, did you see this patient? You can't just say, oh, you know, it's a public assist. No, you're a medical person. You have to document what you find to cover yourself, okay? Because people have lost their jobs and gotten sued and all of that, and it tends to more be firefighters that are unionized and, you know, whatever, because they think they're covered. They're not, okay? Those folks have gotten fired too, all right? So make sure that you're documenting appropriately, because you will get bit in the butt for that. Okay? Don't be lazy. And I don't understand, personally, why anybody cares whether you take them to the hospital or not. You still have to write the stupid report, right? So who cares if you have to go 15 minutes to the hospital with the patient? You know, I don't get that. Like, you're gonna be lazy. How is that lazy? You just have to sit in the back of the ambulance, right? You gotta write the report anyway. So, whatever. Sorry, I digress. It drives me insane. All right. Anything else that they might have? Besides, we said MI. Okay, could be some sort of brainstem disorder, right?
It could be a clot.
Cancer. Yes, very good. It could be a clot. It could be from an MI, it could be a stroke, it could be a PE, right? Okay. If it's a PE, are they always going to be short of breath? No, it depends on the size of it. It could just make them syncopize. So it's actually a fairly high percentage of syncope that is caused by PEs. They don't always find them in the ED if they're not looking for them. Anything else?
What was the initial question?
Syncope.
What causes it? Okay. Shock?
Okay. Shock.
Like, psychological shock?
Okay.
Causing that, the vasovagal and the,
Okay, so
Yeah,
causing
like-
the vasovagal. Okay.
yeah.
So, the thing that's in EMT textbooks about, you know, psychological shock is not really a form of shock. Right? That, they don't teach that in medical school. That's like, they looked at me like I had 14 heads when I told them that. They're like, huh? So, it can cause syncope and a vasovagal, but it's not a form of shock. But yes, it can make people pass out.
If you have like your equilibrium off in your ears,
Ah,
that can cause.
do you remember what that's called?
Yeah. Is it?
Begins with an M, it's Meniere's disease. Yes, yes. That can make the room spin, yes. So it's an inner ear disorder, yep. Overdose, yep. Or just, doesn't even have to be an overdose, it just could be some sort of substance, right? What else do people with hypertension get sometimes? Yep, could be tachycardic, usually pretty fast, but it's also another vessel type disorder. Yes, okay, so they can have an aneurysm, right? They could have AAA, they could have a thoracic aneurysm, have an aneurysm in the brain, so any of those things can cause a big mess. Okay. So syncope is not necessarily simple. The most simple kind is vagal induced, that usually resolves, but all the other things take some investigation, and they do need to be seen to get that taken care of. Let's face it, people don't always want to go to the emergency department. I get that, but you know, it's an inconvenience, but it also can keep you alive. So, or find things that you know are going to be a problem for you going forward. All right, questions about that? So are we gonna RMA our syncopes?
No.
Should they be ALS?
Yes.
Yes. Yes, they should. Good. All right, so,
I have a question. before
Yes.
you move on. Can dehydration also cause?